Hi, good evening. Hope you are getting my video and audio properly. If you are getting my video and audio properly, please comment. Yes. If you are getting my audio and video properly, please comment. Yes. Thank you, Vinish. Vinish commented yes. Okay. Thank you for your reply. Hope the video and audios you are getting properly. So we will start our free live class, MCQ and core point discussion. Today also the topic is fundamental of nursing. So for one or two class we will conduct fundamental of nursing subject so that you will get more and more. See, in the first class we took some some questions. We discussed some questions along with we discussed some topics. Today also we will do the same thing, and on the the next coming days also we will conduct more and more somewhat advanced question or complicated questions, so that you will be able to score more marks from the fundamental of nursing. Okay. So before starting the class, just 1 minute. I'll just okay. Before starting the class, we are providing Aiims Norcet free live class, and these classes will be available, or we will conduct this type of class till Aiims exam. Also, we are providing crash course for the Aiims, which include completely live class. It will be in our online, the website only. That classes will be available. That is Aiims crash course. It's a booster class for those students who are preparing for Aiims Norcet. We are already providing another coaching, that is complete coaching for Aiims Norcet, Nimhans, and other competitive exams. For that, the fees is 3,500, and that you can available from our website. Or if any one of you interested for joining that courses, you can WhatsApp me on my WhatsApp number 735618280. This is the WhatsApp number of Neuro Nursing Academy. Okay. So hope you are doing your studies very well. Good evening to all. So before starting the class, as always, I used to tell you, the learning strategy, how Neuron Academy, or in Neuron Academy, how we are training the students or how we are guiding the students. So our strategy is that it is a little bit different from other strategies. Like we know that you people are working in hospital and you are having a busy schedule. So maybe you are not getting enough time to do preparation. Means to do a detailed preparation, to do lot of or work out of lot of questions, to study lot of topics, to remember, because we all have a limited space or limited memory power. So by using our limited time, by using our limited memory capacity, how we can score more and more marks and get a good rank in Aiims Norcet exam or any other type of competitive exam. So we are focusing on these things. So our learning strategy is designed like that. So our learning strategy, uh, the first one is you have to study basic and important concept. So important and basic concept you have to study, not in a detailed manner, but you should have some concept. Okay, if I tell some topics, you should have some concept. If you don't have that concept, you can prepare yourself or you can use our online coaching. From that you will get a basic and important concepts. Next, you have to practice lot of exams. All those exams you can practice from any books or any other online exam practices available in the website, or you can use our website. We are giving in the coaching, we are giving online exams for practicing. So in subject wise also we will give the practice, then we will give lot of model or mock test also. Okay, next, after doing all these things, you can also improve your knowledge or improve your rank by doing these core points and MCQ discussions classes. Okay, so we are conducting some core point discussions or MCQ discussion. From these also you will get lot of informations you will get from there. And as I told you before, model exams practice. Okay, then use some tips, some techniques for answering the question. So all together, definitely it will help you to learn, sorry, to get a good rank. Just think, okay, if there are a lot of students, they are studying for years and years. I know a lot of students, they are preparing for years and years, 2 year, 3 year, they are preparing. They have undergone coaching from great institute. They are reading lot of books. Still, they are not getting the selection because the problem is that their techniques, the techniques which they are using, because it depends upon you how you will select the strategy. The other people's learning strategy will not be effective for you. The other students or your friend, he may be having lot of memory power. He can sit more and more time in front of the book. He can read. But if you don't have time, if you don't have that type of things, means you have to change the learning strategy, learning style. You have to change. Then you have to prepare. So it's easy if you follow these guidelines. Definitely I can write and give you that 100% you will get selection. So we decide our coaching in such a way that if you complete our coaching or if you follow our guidance and if you study properly, it is not like you are joining our coaching you will get the selection. But if you study the things which we are providing, definitely 100% you will get the selection. Okay, so we'll start our class. Today the topic is fundamental of nursing. The production of the first heart sound is because of which of the following? Production of the first heart sound is because of which of the following? Okay. Now this question I will tell you. This question is a very easy question, simple question. Uh, I know that when you are preparing for central government exams, Aims or any exams, these kind of topics you will see these kind of topics, and you will think that okay, it's a simple question. It's a simple question. I can answer. And what you are doing, you will go for checking some difficult topics and you will spend time on that difficult topics. But this simple question, you will not notice. You will think that okay, I know I can remember. But when the question will come, these questions will make you more and more confusion. So that's why it's very important to learn these simple topics also. So the production of the first heart sound is because of which of the following? Closure of semilunar valves, contraction of atrial musculature, rushing of blood into ventricle, closure of atrioventricular valves. So four options I have given you, and very well you can answer. Don't worry whether your answer will be wrong. No problem, no problem. Okay, because there are we all are not perfect people. We all having some lacuna. So don't worry if your answer is wrong, no problem. But just answer, just answer. Okay. So normally, some people they know the answer. Some people they know the answer without any confusion. But some people they may have confusion. Okay. So normally some students will get confusion like between option A and option D. Is it semilunar valves or is it atrioventricular valves? Sometime. Okay. So it's a simple question. Okay, so the answer is closure of atrioventricular valve. So let's see some information regarding this first heart sound. So when in the first class also I told you we are learning together, because I know that you don't have any other time to study these things again. So here itself we will study these things. Okay, and just um, just note that important points in a notebook, and you can review that notes before your exam. Okay, so there are mainly four heart sound is there: first, second, third, fourth. Easy, no? First, second, third, and fourth. So regarding first heart sound, if I tell you regarding first heart sound is heard as lap. Normally heart sound you can hear like lub dub, right? So the lub sound is called as heart sound, first heart sound. It's simple. Okay, simple point only, no need to note or something. Lub. Okay, second, it occur at the beginning of ventricular systole. No need to note it now. Just okay, just by heart it. Just by heart it. If you are thinking about how what is a ventricular systole, what is atrial systole, don't go in a detail. Okay, just imagine that. Okay, this is occurring at the beginning of ventricular systole. If you cannot remember it, leave it. Leave it. If you can remember, then only okay. It's at the beginning of ventricular systole. The first heart sound is heard at the beginning of ventricular systole. If you can by heart it, by heart it. Otherwise, leave it. But don't go and study this, cardiac cycle fully. Okay, there will be some specific points for the cardiac cycle. That is enough. Because if you go in detail, it will be more confusing for you. It will take more time. If you have time, you read. Okay, if you have memory, if you have that time, that much of time to understand this concept, go for it. Otherwise, leave it. But this point is very important. The important point is first heart sound is occurring due to the closure of atrioventricular valves. So closure of AV valves will cause first heart sound. This is important. Okay. Not that one. Okay, second heart sound, as I told you before, lub dub. So lub is first heart sound, dub is second heart sound. Symbol. Okay, so this one is at the end of the ventricular system. If you can remember, if you have that much memory power, use it. Okay, at the end of the question may ask, at the end of the ventricular systole, second heart sound will heard. End of the ventricular systole. Okay. Next, this is generated due to closure of semilunar valves. Okay, so closure of semilunar valves will create second heart sound. Closure of AV valves will create first heart sound. Okay, you got 2 points. Next, you can just have some ideas. Okay, it's not that much important. Just keep it in your mind when I say these points. Third heart sound, occasionally only you can hear this sound. No, not in all people. Occasionally only you can hear. No need to study. Okay, all these things. No need to study. Just understand. Okay, and you can hear this in youth, athletes, and pregnancy. In pregnancy, ladies and athletes, especially athletes, you can hear this third heart sound. It indicates the beginning of ventricular filling. Okay. The third sound, how the third sound will be heard? Lub dub ta. Okay. If the third heart sound is heard like lub dub ta, it indicates cardiac failure or cardiac problem. Okay. So this is not important. The main point is third heart sound. You can hear in athletes and pregnancy, and it is it is normal, or it is not the abnormal thing or something. Don't worry. If it is heard in athletes and in pregnancy and all, okay, you can hear. Next, you'll see fourth heart sound. Fourth heart sound is a weak and rumbling. Okay, leave it. And fourth heart sound, normally you cannot hear with the stethoscope. Fourth heart sound you cannot hear with the stethoscope. You can record that one by using phonocardiogram. Phonocardiogram. Okay, phonocardiogram. Using phonocardiogram, you can record the fourth heart sound. So normally you cannot hear the fourth heart sound. And it is similar to third heart sound, and it indicates the end of ventricular filling. It indicates the end of ventricular filling. So important thing is, as I told you, first and second. So these 2 points are important. Okay. but I gave you some ideas regarding heart sound, that's all. So don't put all the contents into your memory power. Put all these things into your storage, memory storage. That will be confusing. Take whatever you want, keep there. Okay, take whatever you want, not all the things. I gave you some ideas. Take the things which you want or the important things you want. That's all. Okay. We'll go to the next next question. Which of the following is the preferred site of intramuscular injection in infants? Which of the following is the preferred site of intramuscular injections in infants? Very, very, very simple question. Very, very simple question, because I told you we will go from simple to complex. So first two classes we will be discussing some simple questions, then we will go to the complex one. So when we discuss simple question, that time also we will discuss some topics also. So preferred site of intramuscular injections in infants. If anyone can give answer without giving options, good. Okay, Ipsida telling vastus lateralis, Vinish is telling vastus lateralis. See, in exam, you will be seeing these kind of questions. These kind of questions are called as easy questions. Easy question. Okay, easy question. If you are preparing normally, I am not telling you are preparing in a vigorously you are preparing or you are preparing for a long time. I'm not telling like that. Normal preparation if you are doing, you will you will feel that these are easy questions. So these are the easy questions. Easy questions. Now I'll tell you some tips. Now before discussing this question, I'll tell you some tips. Today's tips. Okay. Today tips. Okay, right. Okay. When you attend exam, you have to attend the exam in three sessions. In the first session, what you will do, you will answer the easy question. Example, see, this is an easy question. Which of the following is the preferred site of intramuscular injection in infants? Means you don't need any options. Without option also you can give answer. Or if I give options, then also you can, you will feel that this is an easy question. So in the first session, you will answer these easy questions. So you will read the question. When you read the question, that time itself you will understand, okay, this is an easy question, you will answer. Then second easy question, you will answer. So all those questions answer which you know, that is easy question for you without any confusion. You will answer. So in the first session you will finish all the easy questions. Same time you will get an idea how the exam paper is. Then you will tell, okay, this paper, you will feel, okay, whether the paper is easy, whether the paper is tough. If you are a normally preparing student, normally studying, normally doing preparation, then after attending the first session, means after attending the, I told you, easy question, take the easy question and answer. So if you will get an idea of the overall paper. If that paper is tough for you, means it is tough for all the people, not only you, for all the people that paper is tough. So you will get an idea, okay, this paper is a tough paper for entire people. If you are preparing normal student, normally preparing. If you are not opening the book and if you are going and answering the question, means you will feel that tough, as a tough exam. But normally preparing students, if you feel in after first session like it is like a tough paper, means it is tough for all the people, don't worry about the exam, relax and continue your exam, because it is not only tough for you, all the people it is tough. So first session you will attend the easy question. In the second session you will attend the medium questions. Medium questions in the sense, there will be some questions where you are having confusion in the option. You don't know the exact answer, but you are having some confusion, whether A or B, whether C or D. These kind of questions are called as medium type of questions, medium tough questions. So in the second session, you will attend the medium type of question in the second session. Okay, so medium type of question, if you have confusion in two options, A or B, C or D. So whatever your mind is saying, give the answer. If your mind is saying, so there were four options, A, B, C, D. And you know very well that A is not the answer and D is not the answer. Now your confusion is between B and C. So whatever your mind is saying, if your mind is saying B, then give answer as a B. If your mind is telling C, give answer is B. Whether it is right or wrong, don't think about it. Go to the next question. So this is the way you will answer easy question, then medium questions. But for doing all those things, you need practice. So with time, you have to practice. When you are practicing, if you are using our website, online exam practicing or coaching website or any other website, use time limit, and with time limit follow this instruction. Use it in a three sessions: easy, medium, then tough questions. Okay. So there will be negative marks. There will be negative marks. So this is the way you have to answer. There will be negative marks. I will tell you how to avoid negative marks and whether you have to attend the tough questions. That all the things I will tell you later, because if I give you all things together, it will be very difficult for you. So today you got the tip that whenever you attend the exam, which is a practice exam or real exam, what you have to do, attend in a three manner. One is easy. First you attend the easy question, second you attend the medium question, then third is the tough question. But whether you have to answer the tough question or not, that we will discuss later, because you are having negative marks. Okay, so in some situation only we will attend the very tough question, otherwise we will leave the tough questions. Okay, that I will tell you later. So these questions, all of you give answer as vastus lateralis. So the options A is vastus lateralis, second is gluteal, third is deltoid and tricep muscles. Okay, so the answer is A, vastus lateralis. Very easy questions, and many times this question have asked, many times. Okay, we will see why this site became, why the vastus lateralis muscle became the preferred site for intramuscular injection in infants and in children. Normally we will use, for adult we will use deltoid or gluteal muscle, right? But we are not using in infants. So the reason is that deltoid muscle is not at all developed in infants, right? In the deltoid muscle is not at all developed in infants. That's why we are avoiding deltoid muscles. But we can use gluteal muscle, right? But we are not using. Why? So there are some advantages of using vastus lateralis muscle over gluteal muscle. That's why we are not using gluteal, we are using vastus. What is that? One is, as you know, will not be any sciatic nerve damage. If we use a gluteal injection in adults also, there is a risk. But very well we can divide the entire gluteal region so that we can avoid the sciatic nerve damage. So in children, we want to avoid the sciatic nerve damage. That's why one reason why we are using vastus lateralis, because in vastus lateralis there is not that much nerve or something which will interrupt with the injection. Then in children you can see more than gluteal region, there is more muscle mass. In children, or sorry, in infants, the muscle mass is larger than gluteal region, larger. Okay, so so that's why we are using. So second reason is there is large muscle mass, then there is no sciatic nerve damage, and third is deltoid in infant. I told you before, it is not developed properly. Then this area there is less subcutaneous fat only. This vastus lateralis muscle area, you can see less subcutaneous fat. So these are the reason why we are using vastus lateralis. So I told you 4 points. The first points I told you, there will not be any risk of sciatic nerve damage. then it's a large muscle mass. Just think, okay, no need to by heart or just understand. And we are not using deltoid because it is not developed properly. So here large muscle is there in the vastus lateralis. There is no nerve damage will happen, and there is less subcutaneous fat only. Fat is very less on the vastus lateralis muscles. That is why we are using it in the infants. Okay. Which of the following is the most appropriate route of routine administration for insulin? So the question is route of routine administration, most appropriate route of routine administration. So this is a routine administration. Okay, routine administration. So this is regarding insulin. Simple question. Simple question. IV or subcutaneous, intramuscular or intradermal. What is the intravenous, subcutaneous, intramuscular, intradermal? What is the routine administration? See, question you have to read. Route of routine administration. Easy question, no? Very, very easy question. But why I took this question means just to discuss something regarding insulin. That's all. So the answer is subcutaneous. Mausmida, Shravana, Rasmida, Ipsida, Sandeep, Vinish, all are telling it's B, subcutaneous. Simple question only. Okay. Normally we are not giving in normal situations we are not giving insulin in an oral way. In oral route we are not providing insulin, right? Why? Means insulin is made up of peptides. Okay, insulin is made up of peptides. So and so insulin is made up of peptides, and if you are giving orally this insulin, these peptides will be digested by the digestive enzymes. So there will not be any insulin for the action. Okay, so that's why we are not giving or administering orally. So if somebody is asking you why we are not giving orally insulin, means you have to tell insulin is made up of peptides. So if I take this insulin orally, my digestive enzymes will digest these peptides, so insulin will not be available for action. So that's why we are not administering orally. Okay. Next topic you have to read, or sorry, you have to study regarding mixing of insulin. Many times this question have asked, mixing of insulin. Okay, so some points, don't go in detail or something. You can note this thing whenever possible, read it and by heart it. Regular insulin is mixed with NPH. NPH is an intermediate acting insulin. There are different kind of insulin, different type of insulin. So you can read all these things from our, if you are using our online coaching facility. In there is our study material and video class regarding insulin. You will get an idea regarding that. Here I am just telling you the important points, so that you will get an idea which topics I have to concentrate, how I have to study, which all are the points I have to remember. For that I'm giving giving this topic. Kamini Chowdhury is telling needle doesn't go into muscle. Yeah, because you know in 90-degree we are giving the insulin injection. Still, it will not the needle is very small, so it will reach only the subcutaneous, and we are pinching the muscle and we are giving. So the needle will not go into the muscle; it will reach the subcutaneous tissue only. Okay, so mixing of insulin. Now, in some situations we have to mix the insulin. Different kind of insulins are there, so we have to mix the insulin. When you study this type of insulin, you have to study one thing. Example. Okay, here I told you NPH is an example for intermediate acting insulin. Like that, there is different kind of insulin. Regular insulin. Okay, you may have heard humulin, all those things. Okay, Novolog, all those things. So you have to study the type of insulin, and it's one or two example for that type. Then its peak action. Different insulin will act at a different time. Its peak of the action peak time is different, so that you have to by heart it. Okay, I'm not going to tell you that here. I'm telling the important point, but I'm giving you which topics you have to focus. Regular insulin is mixed with NPH. So NPH is an intermediate acting insulin. So one point, regular insulin is, we will mix with NPH. Long acting insulin, example is Lantus. Long acting insulin, example is Lantus, cannot be mixed with any other insulin. Okay, so you cannot mix long acting insulin with any other insulin. If you have regular insulin, means you can mix it with NPH, but long acting insulin cannot mix with any other insulin. Then if you are mixing two insulin, okay, you took one insulin in syringe, then you are going to mix with another insulin, means when mixing insulin, always take the or draw up the regular insulin first. You have to take the regular insulin or short acting insulin first. Okay, so which insulin? So in question they will ask you, okay, you have to give a patient like regular insulin and NPH. You have to give regular insulin and NPH after mixing. So for preparing this medicine, which insulin you will draw in the syringe first? So the question is, the answer is regular insulin. Regular insulin always draw up first. Okay. Then we know that the main route of insulin is subcutaneous, but there are some insulin that you can give like IV. Okay, regular insulin is regular insulin is the only insulin that can be given via intravenously. So as a IV infusion, you can give regular insulin, and this is the only insulin. This is the only insulin you can give via IV. Okay, regular insulin. It's an important question. Okay, so these are some of the point regarding insulin. Next, a nurse tells the group that she thinks that the nursing in charge has AIDS. Okay, like HIV. Okay. So nurse tells the group that she thinks that the nursing in charge has AIDS and proceeds to tell the nursing staff that the in charge probably contracted the disease from her husband, who is supposedly a drug addict. Which legal tort has the nurse violated? So this point is, or this topic is very important, like legal implications or legal issues in nursing, or legal aspects in nursing. It's an important topic. One question you can always expect. So here the question is that a nurse is telling a group of nurses, like she is sitting in a nursing station, and she's telling that our nursing in charge is having AIDS, and she's telling that this in charge got this AIDS or HIV infection from her husband, and her husband is a drug addict. She's telling, okay, she's giving some gossip, this nurse. So it's like legally it's a wrong thing, and it's a tort. So which legal tort has the nurse violated? So we will learn now what is tort, all those things. Okay, already we have given class in the website, but we will give some more information. But my main point is that it's an important topic, legal um, legal experts in nursing. So not all the contents you have to study, but you have to study the important things. One question definitely it will come. So here the options are libel, slander, assault, negligence. We will just answer this first, then later we will. Ipsida is telling slander. Ipsida is telling slander. If anyone can explain what is slander, good. Vinish is telling slander. If you can explain what is slander. If anyone can explain what is slander, It's better. What is slander means better. No problem. Okay. Anyway, all are giving answer as B, slander. Okay. If you like our class, means please please like this YouTube video, and please share it with your friends so that they can also get this kind of video classes. So free video classes. I know that in YouTube, if you check, you will get a lot of video classes are available. But as I told you, how we are different from others means we will not give you lot of topics, lot of things, lot of confusing things. Our aim is to get a central government job. We will give you things only for getting central government job, means selection, not we will make you expert in everything. We know that you don't have that much time. Okay, so Sherin, Ipsida, Kamini, Mouse, Mida, all are telling, Mouse, Ipsida is telling oral defamation is slander. Okay, oral defamation is slander, right? Okay, so we will see the answer. The answer is B, slander. We will check what is this kind of defamation, label, slander, all those things. So before going to that, types of law. There are different types of law: constitutional law, legislative, these law, civil law, criminal law, lot of laws. For exam point, I'm telling you the important points which we need for exam purpose. Okay, criminal law. You know what is criminal law? Criminal law means simple. If an individual is making problem to the society, or even if he is moving against the government, and he's doing lot of nuisance against the society, or when he become a threat to a society, and he's doing lot of wrong things to the society, then it's called criminal law. Criminal law. Okay, like doing murder, all those things. Okay, criminal law. Civil law means it's a problem between, okay, maybe a problem between individuals, not with the government or something, not with the society, individual problems. Okay, like maybe problem for the properties or some other small things. That is called civil law. Tort. Tort is a part of civil law. Tort is a part of civil law, and this is also it's regarding the individual and properties. Okay, so simply you just understand that criminal law is there, civil law is there, tort means it's a part of civil law. That's all. The criminal law, it's a serious one, like murder, somebody is making problem to the society and all. Civil law means between people, some fight, all those things. Okay, maybe fight for the property, all those things, like civil law. Yes, for in that you will there will be some fine and all, etc. Tort. Tort means action of crime of making false spoken so out. Okay, we are discussing. Okay, tort. I told you, tort is a part of civil law. Okay, so if there is any problems for the properties or problem between individuals, okay, that is tort. So tort itself, okay, I'll tell you before that types of criminal law. So criminal law, I told you, it's against the society. So types of criminal law, one is felony. Then second is misdemeanor. Okay, misdemeanor and felony. Why I'm telling these 2 points means sometimes you will see these 2 words in option also. Maybe not as a question or answer, but you will see these 2 points in an option also. So if you know the meaning of these things, you can eliminate. Okay, and in some case situation they will ask you as a question also. So I told you criminal law, civil law, tort. And in criminal law, I'm telling there are a lot of types, but mainly, or I'm telling the important one, felony and misdemeanor. Felony is a serious nature crime. Serious nature, like murder, all those things. Serious nature, and and the punishment will be more than 1 year. Punishment will be more than 1 year. That is felony. Misdemeanor means it's a less serious nature in that you will get sometime fine or sometime less than 1 year punishment, all those things. Okay, so you got these two words. When you see these two words, you have to think that okay, this is a I have seen in legal experts in nursing, or I know that these two words connected to some legal things, and I know that these two words are related to criminal law, and these are types of criminal law, and felony is the less serious one, and the misdemeanor is the felony is the serious one, and misdemeanor is the less serious one. At least you should know these 2 points. Okay, these points. Okay. Yeah, felony example. Rasmita is telling felony example, murdering someone. Yeah, all these murder big problems are felony. Now, so I told you regarding criminal law types. Then civil law type. If you take civil law, in that one is tort. Okay. So in type of torts also there are intentional torts. Like intentional means by knowingly. Okay, you are planning something and you are doing these things. This is intentional. And unintentional also. Unintentional means without planning. Okay, without knowingly. Okay, by mistake you are doing some tort, you are doing some mistakes unintentionally, and you are doing some mistakes. It's not like a mistake, it's a wrong crime, it's intentionally you are doing. Okay, so intentional torts, just study the example: assault, battery, invasion of privacy, and defamation of character. Okay, so intentionally you are doing some wrong things. So that is assault, battery, invasion, and defamation of defamation of character. Or then false imprisonment. False imprisonment. Okay, so assault means what? You have to study this example first. Okay, because in a question they will ask you, see which of the following is an example, or which of the following is not an example for intentional tort. Like that question they may ask you. So the exam, you have to study assault, battery, invasion of privacy, defamation of character. Assault means what? Assault means, in some situation you are doing harm to the others, like you are going to beat them, all those things, assault. And doesn't mean that always you have to beat or touch the patient. Without touching also you can assault someone, like threatening. This is also assault. So assault means you are doing some harm to or injury, giving injury to others, or sometime without touching also you are not giving injury, but you are threatening that I will do that, I will do this, I will kill you. All these things also comes under assault. Okay, battery means what? Battery means you have to touching a person without consent, without permission, you are touching the person, that is battery. Invasion of privacy, you will in sometimes everyone is having their own privacy, but you are entering into their privacy. This is called invasion of privacy. It's a intentionally you are sometimes you will enter into their other people privacy. It's a wrong thing. Defamation of character. So defamation of character means defamation, like you are spoiling someone's reputation, that is defamation. Famous, you know what is famous? Famous means what? You are becoming you know knowing by everyone. Famous is a good thing, but defamation means opposite. You are spoiling someone's reputation, that is defamation. Defamation of character. So if you are telling some gossip against someone, that nurse is like that, in charge is like that, this patient is like that, so you are telling a lot of gossip, bad comments, all those things are coming in under defamation of character. And you can do these things by speaking and by writing. Okay, you can write some bad comments, bad things about a person, that is writing. Or you can speak, like before the nurse told that others that okay, this nurse is having AIDS. So by speaking she is giving defamation or spoiling someone's somebody's character. So by speaking, if you spoil somebody's character, we will tell it as slander. By writing, if you tell someone character, is libel. Okay, by writing, if you spoil someone reputation, libel, and speaking, slander. Both comes under defamation of character, and defamation of character is a example for intentional torts. Okay. Next, unintentional torts. You know that what is that? Malpractice and negligence. We will discuss when these things later when we discuss some other questions. Malpractice and negligence. Okay. When a client is confused, left alone. Next question I'm telling. When a client is confused, left alone with the side rails down and the bed in a high position, the client falls and breaks hip. What law has been broken? Okay, so there was a patient was confused patient, and as a nurse you have to give care, but you left alone that patient, and the side rails were not closed, it was down. Okay, side rails were down, and the patient, what happened, patient fell down and the patient had a fracture. So what law has been broken? What law has been broken means what kind of tort you have done, problem you have made. Okay, so example, sorry, okay, so options: civil tort, negligence, assault, and battery. Assault, battery, negligence, or civil tort. What will be the answer? Sure, it will not be battery or assault, and civil tort and negligence. Giving answer as B. Varsha is telling B, Soumya is telling negligence, all are telling B. It's a easy question only, negligence. So negligence is a unintentional. You are by mistake you are doing this thing, not knowingly. Okay, so it's called as negligence. The distribution of nurses to areas of most need in the time of a nursing shortage is an example. So the distribution of nurse to areas of most need, like we can say like floating in hospital, there will be floating, like sometime in one one nursing station is having a shortage of nurses, but other nursing station there is less patient only and there is excess staff nurse means, or nursing officer means, what we will do, the nursing in charge will distribute or post that nurses in the other ward. So when there is a nursing shortage, when there is a nursing shortage, we are distributing nurses to that area. Okay, we will distribute, no? So it's an example for beneficence, justice, utilitarianism theory, deontological theory, utilitarianism theory, or beneficence, justice. What will be the answer? Ipsida is telling utilitarianism theory. Vinish is telling C. Sharon is telling B or C. See, like that. When you have see this kind of question, for some people it may be like a tough questions, or sorry, medium confused questions. Like you know that the answer is not beneficence, and you maybe if you are sure that you know that this is the answer is not D, but you have confusion between B and C, B or C, B or C. So you can select one thing. If your mind is saying C, if your mind is saying B, okay, B. Okay, so the answer will be B. B, it's called justice. Okay, you are doing justice because justice means you have to give. Okay, there are some nurses, they don't have work, and but other place there is lot of work and there is less nurse only. So we are distributing nurses to that areas where most nurses needed. So it's called justice. You are doing justice. Okay, justice to all. Like otherwise, what will happen? Justice means what? No, equality or equal work or whatever it is. Okay, justice means everything should be equal. Okay. um, why means otherwise what will happen, some nurses will do more and more duty, more and more work, and some nurses will enjoy, because enjoy in the sense they don't have that much work, they are relaxing, all those things. But at the same time some nurses are doing lot of work. So it is not, we are not doing the justice as a in charge, as a supervisor. We are not doing the, or the supervisor is not doing a justice thing, justice to all. So to make justice, what we will do, where the people are doing lot of work, we will distribute more nurses to that area. So this, the answer will be justice. At the same time, what is, we will see utilitarianism and deontological theory. Both are theories, two theories. And the meaning, utilitarianism theory means, okay, utilitarianism theory means we will not check, we will check the whether, suppose you are going to do some action. Example, somebody, I will tell you by one example. uh, you are going to do a abortion for a patient, abortion. So people will be in a confusion or in a dilemma, or they don't know whether. So we have some type of these kind of problems, no? Like we don't know abortion is good or not. Abortion is good or not. So some people will tell abortion is a wrong thing, because you are going and killing a fetus or a life. You are going to kill a life. But at the same time, some people will tell no, abortion is a good thing, because we are doing this abortion to save mother life. Like mother, otherwise maybe mother life may be in danger. So doing abortion is a good thing, because you can save mother life. At the same time, some other people will tell that killing a life is not a good thing. So lot of theories are there based on that. Example, utilitarianism theory. Utilitarianism theory means, because of doing that action, if there is any good consequences, means that if the result is good, like when after doing abortion, if you can save the life of a mother, otherwise sometime if there is a risky pregnancy or something and mother may die, so there is no problem in doing abortion. If I tell you in simple words, like in some situation, for a good result, you have to tell some lies, right? You will tell some lies to for a good things. Now, we learned that in some situations you can tell some lies, no problem. You can do some bad things in some situation, because the result will be good, like that. So that is what a utilitarianism theory. Utilitarianism theory means, when you do some action, when you do some action, even though the action is a bad one, if you, even though the action is a bad one, but if the result is good, means do that thing. That is utilitarianism theory, people say. Deontological theory, people telling that don't do a action if the result is bad, or if the consequence is bad, like abortion. In abortion, when you do abortion, the child, you are killing a life, means never and ever do abortion. That is what deontological theory people telling. Utilitarian theory people telling that after doing abortion, if you can save a life of a mother, then do that abortion. Don't think about you are killing, because that in abortion, the all those things, no, the life is not yet developed. All those things. Okay. So this is utilitarianism theory and deontological theory. Okay. Trying questionable and experimental forms of therapy is a behavior that is characterized of which stage of dying. So this question you have to read like this. Some people they can read easily some questions. Some people after reading question also they are confused. Okay. So trying questionable and experimental forms of therapy. Up to here you have to read trying. You are going to try what you are going to try. Experimental form of therapy. You are going to try some different experimental treatment or questionable treatment. It's a behavior that is characterized by which stages of dying. So you know what is stages of dying? DABDA. In the last class we learned DABDA. Stages of dying, stages of grief, all those things. DABDA means what? Denial, anger, bargaining, depression, acceptance. Okay, so all these things we learned as a stages of dying. What is the stages of dying? Kubler-Ross theory is a simple question. So simple question we learned already. DABDA. Okay, I know. I hope you people do know that thing. Okay, so you'll see. See, without giving option, mouse me is telling bargaining. Yeah. Okay. Good. Mouse me because easy question only this one. Okay. Bargaining, acceptance, anger, and depression. Which stages will be there? In which stage you will do this kind of things? Like you will use different forms of therapy, even though you know that this therapy or treatment is not successful. Then also you will do that. You will tell, okay, no doctor, no problem, doctor, do that thing. Some people will tell, no, I am ready to take this patient to anywhere. I'm ready to go for treatment anywhere. I'm ready to go America. I'm going to go here, there, Aiims, anywhere. So this kind of behavior is a stage. Which stage of dying? It's told bargaining, right? Bargaining. Because in bargaining, you are bargaining with for your life, okay, or with your life you are bargaining. Like I want to get my life back, or I want to get my relative life back. I mean, I want to live more. So I'm ready to undergo any type of treatment. I'm ready to spend money. So these all things are bargaining stage. Acceptance means what? You will simply you will do some prayers. Your attitude will change. You are going to a temple. You are going to church. You are always praying. You are giving money to others. You are sitting simply. All those things are acceptance. Okay. So here the answer is bargaining. Okay. Okay, now we will do some drug calculation and IV flow rate calculation, all this max. If you have paper or pen with you, you can do the max there. So here now I am going to put you simple question only. In the upcoming classes, we will put some complex questions. Okay, complex questions. Okay, so here your patient has a heparin drip running at 36 ml per hour. 36 ml per hour. So now you are having a heparin. Heparin is going 36 ml per hour. Okay, the heparin bag reads 12,500 units per 250 ml. So how many units per hour is the patient receiving? So you are having a bag now. Okay, there is a patient. You can, if you know how to calculate all those things, just do your calculation. Don't listen what I'm saying, because I'm saying this for some people, for those who didn't understand this question. It's a simple question only. If you know this answer means, or if you know how to do means, you can do the calculation, no problem. Okay, so here there is a heparin bag. Heparin bag contains, or in that heparin bag it written as 12,500 units, because heparin, all those things will be mentioned in unit. 12,500 units per 250 ml. There is a bag, and now you are giving heparin, or heparin drip is going from that bag, and the speed, if you ask the speed, I will tell 36 ml per hour is going. 36 ml per hour is going. So you just want to convert this 36 ml. The question is that how many units per hour is going. So 36 ml per hour is going. So now you have to answer this 36. You have to convert this 36 ml into unit. That is the question. That is the question. Vinish already given answer 1800. We will check. So we will check here. they have given you in ml, you want to convert it into units. Okay, so here 12,500 units equal to 250 ml, right? See here, see here, they have given. Okay, means right again, 250 ml means 12,500 unit, right? So 1 ml means what? 12,500 divided by 250. This is what? 1 ml. 1 ml means 12,500 divided by 250. You got what I have written here? No? Simple things only. 250 ml means 12,500 units. How I got this one? Because it is already written here. See, 12,000 units per 250 ml. So 250 ml means 12,500 units. So 1 ml means 12,500 divided by 250. They have asked you 36 ml per hour. So 36 ml you have to convert. 1 ml, now you know what is 1 ml. So 36 ml means what? Just what you have to do? Just multiply with 36. So you will get the answer as 1,800 units. Simple question. I think you know this one. Simple question. So in this kind of questions, what will happen? Normally, you know the concept, everything, but you will make mistake by when you do calculation. So please, this kind of question, definitely you can score 1 mark or 1 point, but you have to do the calculation properly. Okay, very easy only. I hope you understood. Okay, because they told that 12,500 units per 250 ml is the bag you are having and already going 30, and you are giving 36 ml per hour. They are telling you in ml, so you have to convert into units. Just simply you can do this, and you will get the answer. Next one, you have an IV BP of ranitidine 50 mg in 500 ml dextrose 5 to run over 30 minutes. So here also the question is very simple. Question is very simple. But sometimes when you read, you are sitting in an exam and you already attended a lot of questions, and when you see this kind of questions, suddenly you will get, if you with a fresh mind you can easily answer. But sometimes in some people, not all the people, if you have practiced a lot of questions, easily you will read. Okay, but some people, they will make mistake, they will think, okay, what is this, very confusing. So leave, when you read, in the this drop factor question or flow rate questions or drug calculation questions, all these things avoid. Like, you have an IV BP of ranitidine Sandac 50 mg. If it is ranitidine, pantoprazole, whatever it is, ranitidine, pantoprazole, whatever it is, don't worry. uh, Vinish, just send me Aiims exam notification. As we expected, the date is on 19th September. Vinish, just send me. If Vinish was there in the online. Vinish, you got this news from from the website, or somebody forwarded you? Because Vinish just send me a message now, like the exam, the notification came on the website, Aiims website. Notification came, a exam is on September 19th, like that. Now the information came. Anyway, we will check. So we already we expected the exam 19th September 19th. So I think it's a real news, not a fake one or something, because from the website only. So please do your preparation, everything properly. Don't waste your time. Okay. Okay, thank you, Vinish. We will continue with these questions. So you have an IV BP of ranitidine Santac 50 mg, whatever it is. This is, you just simply think that this is A. Medicine name is A. That's all. So like that you have to do. Okay, a medicine A. You are medicine A in 50 ml of dextrose 5. So dextrose 5, there is 50 ml of dextrose 5. Dextrose 5, 50 ml is there. Okay. In that there is A medicine, B medicine, C medicine, D medicine. Not a problem. Not a problem. If it is 100 mg, 500 mg, no problem. You just take this one only. 50 ml dextrose means 50 ml dextrose or 50 ml fluid is there, that you have to run over 30 minutes. That's all. So this question became more simple. 50 ml dextrose. So 50 ml fluid you have to give within 30 minutes. Okay. Put the options on. 50 minutes. And the tubing has a drop factor of 15. Always they will give you the drop factor. Tubing has a drop factor. Means each tube is different. Macro drip like that. So by using that IV tube, how many drops per minute you will set on the IV infusion? So you will set. You have to finish 50 ml within 30 minutes. So and the drop factor is 15. So how many drops you will set? So simple. How much we have to give? So the formula, I think you know that, volume in ml divided by time in minutes. Okay, here ml and here minutes multiplied by drop factor. I know, I think you all know this formula. So volume is how much? 50 ml divided by 30 minutes into 15 is the drop factor, right? Drop factor. So if when you do this calculation, you will get 3 will be here, 5 and 25. So 25 GTT. GTT means a drop. 25 drops per minute. Simple only. Okay, simple. So for making you confusion, it's a simple only. For making you confusion, they will tell, like this. You have an IVBP of ranitidine Santac 50 mg for 50 ml dextrose 5, like that. So you will get confused. Just think what they told, 50 ml to give. In that 50 ml they add 50 mg, 500 mg, 1 kilo, whatever it is, no problem. Okay. So it was also a simple question. Next question is, a patient is to receive cefuroxime 1 gram in dextrose 500 ml every 8 hours. So as I told you before, just ignore all these things. Just think that medicine A in dextrose 500 ml. Dextrose 500 ml. So in dextrose 500 ml, dextrose 500 ml, you have to give every 8 hours. So here also they are confusing. Okay, in every 8 hours you have to give dextrose 100 ml. That's all. Now I put simply this question like 100 ml, 100 ml fluid you have to give every 8 hours. Okay, every 8 hours you have to give 100 ml. Whatever, A medicine, B medicine, C medicine, whatever it is. Okay. And so 8 hours you have to give 100 ml every 8 hours. If it is 4 o'clock means you will give 100 ml. Then next 100 ml you will give 12 o'clock. Next 100 ml after 8 hours. Next 100 ml after 8 hours. So and you have to infuse this over 60 minutes. Simple question only. But sometime when you read, it will you will get confused. I'll give you the option also. So you have to infuse over 60 minutes. So simple. What you have to do, They told every 8 minutes. Okay, Vinish messaged me. It's like a fake message. I told regarding the regarding just now I got a message like regarding the Aiims date. It fake message like that. Vinish messaged me, but see, already they scheduled in the website like September 19th. So keep in your mind that exam will be on September 19th and study. If the exam is extending, good, we will get more and more time for preparation. So now you keep the time limit for your studies September 19 and prepare. Definitely you will get. See, if you see the question paper, uh, you will understand that okay, there are a lot of easy questions were there, lot of questions you can answer like that. The thing is that a problem from your side, you didn't prepare well, you made some mistakes, that's why. So now you people, not all the people, a lot of people are in touch with coaching, or a lot of people are in touch with study. Whenever they are getting time, they are studying, they are opening the book, studying. I know that you are not always studying, but at least you are studying now, you are opening the book, studying. So these kind of attitudes, these kind of activities, what will do means later you will get idea, okay, this kind of questions are asking, this is the level of exam, this kind of questions may topics may come. You will prepare day by day, you will improve. And when you will attend, if for maybe for the first time when you attend the exam, your rank will not be good, but next time it will improve more and more, and you will come to a stage that every exam you are going to attend, you will get selected. Because I know many students, they took time to get their first job, but after that whatever exams they are writing, they are getting selection because they got that point, how to answer, how to attend the exam. They got that. It is not like they studied all the contents, the entire nursing subject. It is not possible. But whenever they are attending the exam, they are getting selection because they got that knack, that technique they got. So you will also get that technique. When you get that technique, it will be very easy to get this central government job. For that, you don't want to know what is happening means people will go and join coaching, or in our coaching or any other coaching, then they start to study. They and lot of contents, lot of topics, lot of questions, these kind of things, lot of means hours and hours of classes. At last the student, he get bored, he get irritated, he get frustrated, then he started to hate study. He's thinking how I can study all these things. Some students, they don't have any problem, but other students, they are leaving study. Okay, I know, they are thinking that it is not possible for me to study all those things. Then they are leaving. Then they are not thinking about central government job. Then they are telling others it's a difficult job. They are telling don't go and prepare for that. It's a difficult problem, difficult job. It will not be suitable for me or you. You can't do this. You can't do this. No, it is possible if you do in a proper technique. Understand, you have to understand what is competitive exam. It is not like you will take all the books. Lot of teachers will teach you all the things in inch by inch, step by step. No, yeah, you need learning. You need learning, but it is not like in such a way. You can do in such a way if you are having, I told time, you have a lot of time, you have a lot of memory, you want to get first rank, second, then okay. Otherwise do it like this, step by step, you will get. No need to spend more time, no need to spend more money. Okay, okay, anyway you will get understand now when you are answering these questions. So those students who are attending this class, I hope that your level, just think about your previous level, what was your previous level and what was your present level. Even you feel that okay, I have learned something, or I improved, I know something regarding central government. Because a lot of students, when they asked me before joining our online coaching, or when they asked me regarding regarding how to do the preparation, I told them these kind of things. So I told them that one day you will feel better, or now I think you people are feeling better. Yeah, this is the things. So if you can continue this spirit, continue these efforts in the coming days, you will improve automatically. You will get selection. Okay, if you feel like you improved more, then it's a good sign. Continue, then definitely you are going to get the central government job. Okay, these questions, within 2 questions we will finish, because I'm not going to take more and more time. I know that lot of time, uh, for study also there should be some time. It's not like you will sit with the book from morning to evening. No, no. If you want, you can sit, but if you are having the idea, or the technique of studying, means within 1 hour 2 hour also you can study the things which you are studying, which you are taking one day. Okay, some students they will take only 1 or 2 hour and they get selection, because they know what to study, when to study. It's not like you are sitting with the book from morning to evening. No. Okay, so here the question: every 8 hour you have to give 100 ml. So whenever you give 100 ml, so suppose if you are giving 100 ml now at 5 o'clock or 6 o'clock, means you have to finish that within 60 minutes. So how much ml you have to give? You have to give 100 ml. 100 ml you have to give. So volume means 100 ml. Time is 60 minutes. This is in minutes, so I don't want to convert. If it is in hour, I have to convert. This is in minutes, so no need to convert minutes. And drop factor, they have given 10. Sorry, 10. They gave given 10. So what will be the answer? I will divide with 6. All right. So 1, something like a 16.66, right? Something like 16.66 will be the answer. 16.66 will be the answer. Then, so the answer is 16.66. Then you can round this one to the next complete number. So 16.66, I can write it as like 17. If the answer is 16.33, means I will write it as 16. So here it is 16.66, no, 16 and half, more than 16 and half, so I will put like 17 as the answer. If it is below 16 and half, means I will put as 16. So the answer is B, 17. Okay, so in the next classes we will do more complicated questions. Last question. Okay, doctor order Sofran 4 mg IV every 8 hours for 48 hours. So doctor order, just think, okay, your doctor, you can put one name, Dr. Deepak. Dr. Deepak came and doctor is ordered 4 mg Sofran, Cifran, whatever it is, A, B, C, D, whatever you can need. So doctor ordered a medicine medicine A 4 mg every 8 hours. So 4 mg medicine every 8 hours they have to give. So for the next 48 hours, so for the next 48 hours you have to give 4 mg medicine, that also every 8 hours, every 8 hours. So how many mg will the patient receive total during the 24 hours period? Okay, so doctor told next 48 hour you have to give this medicine, and this medicine you have to give every 8 hour. Every 8 hour means what? If it is 12 o'clock, means next 8 o'clock, then next 4 o'clock, then next 12 o'clock. It's like 8 hour means one day 3 times you have to give, right? 8 hour means what? 8 hour, if I'm telling 8 hour, every 8 hour you have to give medicine, means one day you will give 3 times, right? Or in 48 hour, if I divide with 8 hour, total 48 hour you have to give. Okay, during 48 hour you have to give. So every 8 hour you are giving, means you have to give how many time? 6 time. you have to give 6 time you have to give. This is 48 hour. In 48 hour, how many time you have to give? 6 time you have to give. So 24 hour, how many time you will give? 3 times you will give. So 3 times means 1 time you will give 4 mg, right? 1 time you are giving 4 mg. So 3 time 12 mg, right? Simple question only, no? Simple question only. Okay. So the question was, you have to give one medicine every 8 hour for 48 hours. So every 8 hour, 48 hours means in 48 hours you will give how many times? 6 times you will give. But they have asked you in 24 hours how many mg you will give. So in 24 hour I will give 3 times. So in one time I am giving 4 mg means 3 times I will give 3 into 4 mg means 12 mg per day. Simple, very simple question. Okay. So in the next upcoming classes, we will discuss more and more complicated question. And you think that the exam is going to come on September 19th. Okay. So every exam, okay, believe in yourself, you will definitely, those people who just now attended, definitely they all will get the central government job. What they have to do, study in the same manner how you are doing. As I told you, basic concept. If somebody asks you some concept, you have to tell. I am not telling that you have to be expert in that thing, but you have to tell, okay, these things, and some type of specific points is there, you have to tell that thing. Then practice more and more and question, that's all needed. Okay. So any of your friends, seniors, juniors, colleagues, or students, they want to attend our online coaching. 1 year validity coaching is there. Anytime you can study at your own speed, at your own pace. Okay. Anytime you can attend. No need to wait for the teacher or something. There will be recorded video classes. So we have a complete online coaching. 1 year you can use. 3,500 is the cost. 3,500 for total 1 year. You will get the full support. Or those people who want to get, okay, there will be some people, they want to get only the crash course, they don't want 1 year or something. Crash course we are going to start on August 8th. It will be completely live class. August 8th, completely live class. And but if you are not free on that live class timings, you can watch the recorded class. It's not on YouTube, it will be on our website itself. And the fees is 1,800, and the class will be till Aiims exam. You will get it. And those people who are interested to join, you can join, or you can continue your own preparation. No problem. Prepare yourself. But think in your mind that the best job as a nurse, if you are working in India, the best job is in central government, not in private. Private you will get less salary, lot of problems. So believe in yourself, don't waste your time, because a lot of students, they approached me telling that they crossed 30 years and they want to prepare. I told it's not possible unless you don't have any reservation or something. So don't waste your time, believe in yourself. Spend some time for your future. You are spending a lot of time in hospitals for your for hospital, when you are working, you are giving your energy, time, everything to the hospital. At least give some time, some energy for your I mean your future, and you can build a good career. I'm happy to see lot of students after attending our coaching, they got, and they are always messaging me. Even today also one girl messaged me that I told that it's her skill, it's her talent, it's her ability. Still, she told me that she got the selection. So I'm very happy to know that. So like that, you people all will get. So those people who are interested to attend, they can contact on WhatsApp. I'll repeat my WhatsApp number 73561828880. Also, if your friends or anyone wants to attend free live class will be limited, but free live class, because you will not get any exams for practicing free live class, only live class. You can WhatsApp me and you can join the free live class also. So thank you for attending this class. Whenever possible, just message any changes in your classes. and message your opinion about our classes, so that it will be helpful for me, for us to change from our side to do some changes in the class settings, everything. And if you like this class, please share this one, and also please message me to my WhatsApp number the your feelings or your opinions about the class. Okay, so next class I will update in the WhatsApp group. Please join the WhatsApp group. In the WhatsApp group you will get the link, all the class timing, everything. See you later. So big thanks. uh, okay, big thanks from Neuron Academy, and all the best. Okay, thank you.